So welcome, we're just going to quickly run through some instructions on how to find surface anatomy structures on the hip. So, starting with looking at a skeleton, a few of the structures are really quite simple. How would you find the iliac crest, for example? And you're allowed to speak.
Hands on hips.
Yeah, pretty much, you just put your hands on your hips. So looking at the skeleton here, if you just put your hands on your hips, that bony ridge that you hit should be the iliac crest. Now on most people, pretty easy to palpate, especially at the front. So the anterior, superior iliac spines here on either side should be pretty easy to find. But how can you quickly make them even easier to find? Get the person to lie down. So if the person is lying down in a supine position, so face up, what would happen is any softer material that's around the iliac crest or the anterior superior iliac spine is getting in the way, kind of fall away a bit, but the bones will stay exactly where they are. And so the iliac, particularly the anterior superior iliac spine, will become more prominent. So if someone's lying down face up, pretty easy just to put your fingers on the anterior superior iliac spine. Now the reason we're particularly interested in that one today is we also want to find a structure called the pubic tubercle. Now this one's a little bit tricky and you do need to be pretty careful when you're finding this one. Does anyone already know the trick to finding it? No, you use the heel of your hand. So we're going to use this part of the hand to palpate for the pubic tubercle because the pubic tubercles are here. So they're either side of the midline on the pubic bone, and they're obviously the genitalia are just here, and you don't want to accidentally palpate someone's genitalia. It's definitely not what we're trying to do. So we're going to be very, very careful. What you do is you can do it with someone standing up, but it's a good idea to do it with someone lying down. It's best if they can be as relaxed as possible. So what you're going to want to do is have your fingers pointing towards their thorax and have the palm of your hand on their abdomen, on their anterior abdominal wall. And what you're doing is you're pushing in with the heel of your hand, so this part here, and you're trying to find the bone. So that when you do hit the bone, you hit it with the heel of your hand, not with your fingertips, and you're trying very, very hard not to go too far inferiorly. Now, for today, when you're doing this for the first time, really good idea for whoever's being the patient, whoever's being palpated, to when they're lying down, find it on yourself first. So the patient finds it on themselves first, so that they know where it is, so that when the person is palpating to find the pubic tubercle, you can say to them, yeah, you're close, right, that's it there, stop there, okay? And that way you're sure that there's not going to be any problems, okay? And once you're very used to doing this and you're a professional and you're working with a patient, you're unlikely to ask the patient to find it. You know, just do it this way. But by then you'll be really used to it and you'll know where it's going to be, and you'll be very professional and it'll be quite simple for you to do. But for now, when you're learning, take it slow. Get the patient to find it first, but then work your way down and speak to each other, communicate, work together. Make sure you find the bone with the heel of your hand. You'll have to press a little bit firmly, and then carefully turn your hand around so that your fingertips are now palpating the top of the pubis. Now, in the midline, you probably won't feel any particular eminence, but either side of the midline, you should be able to feel a protuberance, a little bump there, a tubercle, okay? So that's the pubic tubercle. Now, the reason we're finding the ASIS and the pubic tubercle is what? What goes from the ASIS to the pubic tubercle? No? There's a ligament. The inguinal ligament. So the inguinal ligament runs across here. Now, and if someone if you're looking at the anterior aspect of someone's body, you can see usually a crease there or a line there where the lower limb joins the torso. So it's the groin, basically, where the groin is going to be. Now, the fibres are running this way. So if you just kind of prod and try and find the ligament with one finger, or you run your fingers kind of along where the ligament runs, you won't feel a thing. But if you get a couple of fingertips in there and you move across the fibres of the ligament, you will feel it. In most people, it's really quite palpable, quite easy to feel. So we're wanting to find the two ends of the ligament, because what we want is to actually find the midpoint of the ligament, okay? So what we want is for you to palpate the midpoint of the inguinal ligament, and then you're going to palpate quite firmly. But before you do that, the line of the ligament is here, so here, and you're going to just move into the middle of the ligament and then move 90 degrees to that line. So if that's the line of the ligament there, you're going to move inferiorly and laterally 90 degrees, so in a straight line away from the line of the ligament, and then you're going to palpate deeply. What you're trying to do is find the head of the femur. Now, it's quite possible that you'll hit the hip bone, but you may first go manage to find the head of the femur. Now you're going to have to palpate firmly, and remember, if someone's experiencing any discomfort or pain, if you're the patient and it hurts, tell the person that's palpating. You're not supposed to feel a lot of pain or discomfort. So if they're palpating and it really hurts, they're in the wrong spot, or there's something painful there that they're impinging, and they should stop. So tell them. You're not expected to put up with pain or discomfort. But it does require firm palpation. Often when students can't find it, the problem is they're being too gentle, and that's lovely, but you do need to press firmly. Now, how are you going to know, though, whether you're on the hip or the femur? What's the trick to tell you which bone you're on? Because I feel pretty much the same. What can you do, or what can the other person do that will help you work it out?
Move their thigh and flexion.
They could move their thigh. Now, if they move their thigh, what will happen, though?
It will roll back.
Could. Now, what you want is movement, but if they do the movement for you, what's running across the front of the joint? The muscles, yeah. So the iliacus and psoas major and then iliopsoas below the ligament are running right across the front here. So if the person does any flexion at all themselves, all you'll feel is muscle. And that's great if that's what you're wanting to palpate, if you're wanting to palpate the active muscle. But if you want to find the head of the femur, what you want is for them to be relaxed. So you need to move their femur. Now, when you're first doing this, that might be a bit tricky. You might be better off to get someone else to do rotation. So what you want is medial and lateral rotation of the femur. So if you're working in groups of 3, one person can be rotating the femur while another person is palpating and trying to feel the head move, okay? Because you want the patient to be completely relaxed. So if you're palpating while there's rotation happening and you're feeling a hard structure there but it's not moving, then you're on the hip. Move just a little bit further inferiorly and laterally. It's usually about an inch away from the ligament. Then you should be on the head of the femur. If you can feel it gliding under your fingertips, then you've got it. What else is around here that you're going to need to be careful of, though? What else might you find here in the femoral triangle? No, there's a really big artery. So if you feel a pulse, if you're feeling a pulse, don't move, and then move probably a bit lateral to the pulse, and then palpate firmly there. Don't press if you're feeling the pulse, because all you'll do is impinge the artery, make it hard to find the head of the femur, and of course eventually the person's foot will go blue. We don't need that. So if you feel the pulse, just move off that. Any questions on that so far? Okay, wonderful. Righto. So that's the ASIS, the pubic tubercle, the inguinal ligament, and then trying to find the head of the femur. Now, that's probably the most difficult structure we've got today, and possibly the most difficult this session. So if you can manage that one, good. Remember to be professional and always ask permission before you palpate. And there's a couple of others. Now, fortunately, they're reasonably simple by comparison. We found the ASIS already. At the back, the posterior extent of the iliac crest, we have the PSIS. Now again, what will that look like if you're looking at a real live individual? If they're standing up facing away from you, what will you see where the PSISs are? Dimples, yeah, it's actually a depression. So they're bony structures, so when you're looking at a skeleton, they really stick out, but on a real live person, they're actually a depression or a dimple. And that's where you'll feel the PSIS. Now they're quite palpable, usually pretty easy to find, and if you were to put your hands on someone's iliac crest from behind, your thumbs just kind of fall where the PSISs are. Okay? Now if we draw a line across them, inferior to that line will be the sacrum in the midline, and again the sacrum is pretty easy to feel, pretty easy to palpate. There are some muscles that are attaching in here, but by the time they get to the sacrum, they're not too bulky, so you can usually feel these protrusions on the posterior aspect of the sacrum. So that's not too difficult to find usually either. And then there's the issue of tuberosity. Now that's down here, and it says, I think on the instructions, that to make it easier to find, you flex the thigh at the hip because it moves the gluteus maximus out of the way, makes the ischial tuberosity easier to find. That's true, that will work, but when you're learning, there's a kind of safer, less invasive and easier way to find it. What would you do? If someone's lying face down, what would you do to find the ischial tuberosity, to help make it easier for you to feel it? Or to get the correct spot first go? Instead of just kind of prodding them everywhere and going, is that it, is that it? What would help get you to the right spot first go? What attaches to the ischial tuberosity? No, not the glutes. Thanks for having a go at that. Good. The hamstrings, brilliant. The hamstring muscles are all attaching into the ischial tuberosity. So if you get the person to flex their leg at the knee, so you get them to do it, so that the hamstring muscles are now working, you'll feel the hamstring muscles in the middle of the posterior thigh, and you'll be able to follow them superiorly till they become a tendon and attach into the ischial tuberosity. And then you can get the person to relax. You can hold their foot while you're palpating with the other hand, get them to relax, and you should easily be able to feel the bone. It will be under the buttock though, okay? So that's where you will have to be, like kind of pushing into their gluteal region to find it. But if you can follow the hamstrings there, you're not going to get the wrong spot. You'll get it every time that way. So that can be a simpler way of finding it when you're first learning. It's not hard to find, but just to help you get it right first time, that's probably not a bad thing to do. Now I think that's all the structures for today. So go to it, and I'm here to help if you need it. Now,